In the third section of our lecture, now we will talk about the benign tumors of the auricle. In this, we will talk about preauricular, sebaceous and dermoid cysts, keloid hemangiomas and papillomas, and also we will talk about cutaneous, horn, keratocanthoma and neurofibroma. All these are the different types of benign tumors of the auricle. So first, the benign tumors, preauricular sinus or cyst, results from faulty union of hillocks of first and second brachial arches during the development of the pinna. So in this, the preauricular sinus or the cysts, usually they are formed by the faulty union of the hillocks of the first and second brachial arches. So due to the faulty union of the brachial arches, there is development of preauricular sinuses and the cysts. Surgery is indicated if there is unsightly swelling or infection. Cyst or sinus tract must be excised completely to avoid recurrence. So treatment is by surgery, and they are excised to avoid any recurrence. Now this is the picture that gives the dermoid and sebaceous and dermoid cyst. This is the cyst. Cyst is the fluid-filled sacs, and you can see it's a big fluid-filled sac on the back. So sebaceous and dermoid cyst. Common site is post-auricular sulcus or below and behind the ear lobule. So preauricular is in front and post-auricular on the back. So this is the back of the lobule. This is the common site for sebaceous and the dermoid cyst. Treatment is total excision. Total excision should be performed to remove the sebaceous and the dermoid cyst. Again, this is the other site for the sebaceous on the dermoid. So usually present as a mass over the upper part of mastoid behind the pinna. So it can be present on the lower part behind the lobule or on top on the back of the mastoid process or the mastoid bone. So both sides are common, top and the bottom, should be excised completely. Then we have the keloid. This is the picture of the big, huge keloid. Causes of the keloid is trauma, is usually by piercing and surgical incision. Surgical incisions are very common cause of keloid formation, in which after surgical incision there is healing and there is scar tissue formation that leads to keloid formation. It can be genetic, and black are more affected with the congenital or genetic keloids. Treatment is surgical excision, so it should be excised surgically, and injection of triamcinolone that shrink the keloid and treats it. And then radiation, up to 300 radiations are given. Then we have hemangiomas. These are the hemangiomas. They can be present congenitally. Hemangiomas are present. They develop in the blood vessels. Hemangiomas are in the blood vessels. Capillary hemangiomas and cavernous hemangiomas are the common type of the hemangiomas. Papilloma. Then a small wart-like growth on the skin or the mucous membrane derived from the epidermis. So this is the papilloma. If you can see, it's a wart-like growth warts are the viral warts are the caused by the infection as a result of virus, and this looks like the wart. And it is present on the skin or the mucous membrane derived from the epidermis. Epidermis is the top layer of the skin. And it may present as tufted growth or flat gray plaque. So both types, it may be raised tufted growth or flat plaque. Rough to feel, and it is viral in origin. So as I mentioned, warts are viral in origin. These papillomas are also viral in origin. They are rough to feel. Treatment is by surgical excision or curettage with cauterization of its base. Next, cutaneous horn. If you see here, this is the cutaneous horn present here. It's a form of papilloma with heaping up of keratin and present as horn-shaped tumor. So this is the cutaneous horn, which is the horn-shaped tumor. Often seen at the rim of hallux. In elderly people, this is the rim of the hallux, and this cutaneous horn is present there. Treatment is by surgical excision. As with any other benign tumor, surgical excision is recommended. Now this is the keratocanthoma, a skin lesion that erupts in sun-damaged skin rather like a little volcano. So you can see again, it involves the hallux, and it is mostly in the sun-exposed or sun-damaged skin, like keratomas. These are due to exposure to the sun. Keratocanthoma. Benign tumor resembling a malignant one, a raised nodule with central crater. You can see it's like a central ulcer or central crater. Grows rapidly first, but then slowly regress, leaving a scar. Treatment is excision biopsy. Next, neurofibroma. This is a very typical picture of a neurofibromatous lesion. So it presents as a non-tender firm swelling and may be associated with von Reckling-Hausen disease. So this is the neurofibroma. Non-tender firm swelling. You can see neurofibromas are different small nodule present. That was all about the benign tumors of the auricle. Thank you for watching sqadia.com.